My name is Ishmael Mbithi. I am a BSN and I am also a health educator. I do this with a group of mine that I formed in the year 2019 called MTUMISHI Ishmael Volunteer Health Talks, or rather MIVHT. I tend to believe that most of you have seen what we've been doing. We've been able to reach out to many people and create awareness. And therefore, if you are new to this, you can reach out to me and I'll give you details on the same. So today I am delighted to bring to us something worthy knowing, something worthy noting, and it is about a normal monthly period. Normal monthly period. What are the characteristics of a normal monthly period? Sorry. And maybe to begin with, I'll pose a question to you. What is menstruation? What comes in your mind when you hear the word menstruation? I'll try my best to simplify this so that you may understand better. And in simple terms, menstruation is that normal vaginal bleeding that happens in a woman every month, a woman of reproductive age. A woman of reproductive age. By the way, I am happy because this talk is relevant because we have so many issues with sexual reproductive health. Many of the girls, many of the women of reproductive age are undergoing a lot of problems when it comes to irregularity of their menses and abnormal bleeding and all that. And therefore, I believe that this talk is very, very relevant and timely. So menstruation, as I have said, is that vaginal bleeding, that normal vaginal bleeding that happens every month in women of reproductive age. So what is this? It is just blood that comes out. But I want to let you know that this blood that you see, it is a combination of various things. One, it is a product of an unfertilized egg. Unfertilized egg. An egg that is released by the ovaries um, every month. Okay, ovulation happens 14 days before menstruation. Ovulation happens 14 days before menstruation. I will clarify this in my next video because you'll learn something else. So we have menstruation is a product of unfertilized egg. Number two, we have the uterine tissue that has been shed off. We have uterine tissue that has been shed off. And we also have vaginal secretions. We have secretions from the vagina. And lastly, we have the cervical mucus. So menstruation is a product of a variety of things. Unfertilized egg, that uterine tissue that has been shed off, or the endometrium that has been shed off. We also have the vaginal secretions. We have the cervical mucus. So that is what comes out. And maybe to let you know, why do we have this shedding off of the uterine membrane, the endometrium and all that? I want to mention that menstruation is a sequence of activities that are controlled by hormones. Hormones are just chemical messengers. So menstruation is controlled by a variety of hormones. One to note is estrogen and progesterone. Estrogen is one of the hormones which is very important because one, it stimulates ovulation to take place. or rather, it stimulates the ovaries to release the ovum. Another thing that this hormone does, it is responsible for the development of secondary sexual characteristics in women. What are some of these secondary sexual characteristics? We may have the, the growth and development of breasts, the enlargement of hips, the menstruation itself, the menopause, and all that. So it is very essential. Number 3, when it comes to menstruation, it thickens the wall of the uterus, the endometrium. The first phase of the menstruation, estrogen is responsible for the thickening of this endometrium. But if fertilization has not occurred, now progesterone takes over. Let me correct this. Estrogen is responsible for the thickening of the uterine membrane in the first phase. But we have this or another hormone called progesterone, which is responsible for preparing the uterus for pregnancy. By the way, let me surprise you. The body of a woman anticipates for a possible pregnancy every month. So this process of menstruation is just but an anticipation of the body for a possible pregnancy, and that's why it releases a mature ovum, because it's just ready for a pregnancy. So we have this hormone called progesterone that prepares the uterus for pregnancy, and it causes the thickening. It causes the thickening of the uterine membrane. But if pregnancy has not occurred, the levels of progesterone drop, and this triggers the uterine membrane to shed off and disintegrate, and it comes out through the vagina as just blood. So if pregnancy occurs, the levels of progesterone continue rising. One, they continue rising to maintain the pregnancy, and number 2, they continue rising to prevent ovulation during pregnancy. So it prevents ovulation during pregnancy. That is the role of progesterone. So the levels of this progesterone will keep on increasing during pregnancy for the reasons that I have stated. Therefore, I want us to now look at the agenda of the day. What are the characteristics of a normal menstruation? I've just defined menstruation. I've said what comprises of the menstruation, the hormones that are responsible for the menstruation, and all that. Therefore, we want to look at the characteristics of normal menses, normal menstruation. One is the cycle duration. And the cycle duration is the first day of your menstruation, the period between your first day of menstruation to the first day of your second menstruation. Cycle duration is the first day of your menstruation and the first day of your next menstruation. I hope that is clear. And for you to know this, to know if your menses are regular, you have to count the length between the first day of your menstruation to the first day of your next menstruation, average of 3 months, for you to know your cycle duration. So the cycle duration should be 28 days plus or minus 7 days. 28 days plus or minus 7 days. So with that, what does that mean? It means your cycle duration could be 28 minus 7, which is 21. You may have a cycle that runs for 21 days, and you may have a cycle that runs for 28 plus 7 days, which is 35. So the cycle duration of a normal menstruation should be between 21 days to 35. Hope that is clear. I hope that is clear. The next thing is the days, the number of the flow. How many days do you menstruate? And we have 5 days plus or minus 2 days. The normal days that you can menstruate is 5 plus or minus 2 days. What does that mean? It means you may menstruate for 5 minus 2 days, which is 3 days, or you may menstruate for 5 plus 2 days, which is 7 days. So a normal menstruation is between 3 to 7 days. Anything that is below 3 days and anything that is above 7 days, that means it's abnormal. The next thing is about the amount. The amount of flow. And I have to say this, that it is not very ideal to measure the amount, but we measure this by the number of pads that you change per day. So a normal menstruation should make you change at least 4 to 6 pads per day. Although this may differ, there may be a variance between the women, but a normal menstruation should make you change at least 4 to 6 pads per day, or rather 24 hours. So if you change just 1 pad, or you change more than 6 pads per day, that means you have a problem with your menses. The other parameter we have to look on is about the pain. A normal menstruation should have minimal or no pain. We should not have severe pain. We should not have severe pain. And maybe to remind you something about the amount, it should not be heavy. You should not have heavy flow. And if you should not have heavy flow, it means that, no, let me correct this. You should not have heavy flow, but your menstruation is heaviest on the 2nd and 3rd day. We have said it should not be heavy, but comparing the first day that you start menstruating, it should be not heavy, but when we proceed to day 2, it should increase in a way, but not extremely. That is what I'm trying to say. So the other thing is about the clothes. We should have no clothes. A normal menstruation should have no clothes at all. The other parameter we have to look at is the spotting. We should not have spotting in between periods. Like you go in the washroom and you find that you have some spots in your pants. No, there should be no spots. And the other thing is about the color. What is the color of this? The normal color should be bright red. Then it could be somehow brownish. Yeah, it should be bright red, brownish. But anything that is very dark red with clothes, that means there is a problem. Yeah, there is a problem. The other thing we have to check is about the regularity. A normal menses, a normal menstruation should be regular. It should be regular. Now, how should we establish that you have regular or irregular periods? I have said that you have to count your cycle duration for at least 3 months for you to be able to establish that you have regular menses. So you count the first month. If you get, like, for example, you have a cycle duration of 21 days, or rather 28 or 35, the next month you get 35, the third month you get 35. Now you are able to establish the cycle duration. So the other parameter we were looking at is the regularity. The regularity. It should be regular. It should be consistent. It should exhibit some consistency. So it should not be regular. Some women will have irregular flow. I think I will do a video on what causes the menses to be irregular. So irregular, I mean, they may delay, they may come very late, or they come earlier than expected, or you miss them at all, what we call amenorrhea. Yeah, you can miss them at all. You fail to experience your periods. That is amenorrhea. They may be delayed and delayed for a months. Yeah, and they may come earlier. Yeah, you may menstruate twice or thrice a month. That is abnormal. So next video I will do is about what causes the irregularity of menses, and what are the possible interventions, the possible ways that you can be able to restore your menstrual flow. I hope you found this video worthy. I hope you found it worthy listening to. I hope you found it educative. I believe that you have gained something. So in case you've got a question, kindly put it there on the comment section and I will be able to answer you. This video is brought to you by MIVHT, MTUMISHI Ishmael Volunteer Health Talks. I am the founder and I am glad that we are advancing our operations every new day. God bless you so much and do you good. Shalom.